Okay, wonderful. Well, thanks for meeting with me, Nick. This is going to be my acupuncture-based Chinese medicine, traditional Chinese medicine-based healer highlight. And today I have Nick Kundrat with us here, who is an integrative health specialist and provider. And he's going to give us the details of what that is, his own personal health journey, as well as like when acupuncture maybe was exposed to his personal routine versus when he wanted to start maybe speaking to it and using it in his own manual therapies. So my name is Marina Mangano, and this is coming from the Gift of Healing Hands acupuncture chapter. This book, just as a reminder, is a guide of these like stacking layers of techniques that kind of broke my like very rigid chiropractic shell. And I was so happy that you were able to read it, Nick. So I'm excited to talk to you today about it.
Yeah, thank you so much for having me on. I'm excited to chat, nerd out a little bit, and
I know.
lots of
This
fun topics on the
This is why I
agenda.
thought of
So,
you. Yeah. So Nick, tell us a little bit about just what you would consider like your healing training.
sure. Yeah. So I kind of started off a little more in the clinical side of things, similar to you.
Hmm.
I studied exercise physiology in school and was trained in kind of how to help people use, exercise and other more clinical modalities to treat their chronic health conditions. And so I fell into that space because I grew up living with type 1 diabetes. So I was always interested to help people who are also living with type 1 and other, chronic health challenges. And from there, as I got a little bit older, as I got out of school, I kind of started facing some of my own health challenges, and the clinical traditional model just wasn't really cutting it. Like it wasn't
Right.
really helping, wasn't doing the trick. So then I fell into more of the holistic integrative space, and I am definitely like a big nerd when it comes to anything health related. So I've
You
kind
have
of
to be.
dipped my
Yeah. Yeah.
toes into like all kinds of different modalities, traditional Chinese medicine being one of them. But I've spent a lot of my time training in health coaching. So, using things like functional medicine lab testing and rebalancing minerals and supplementation and kind of like the foundations of health. Also, getting out in nature, moving your body, nutrition.
Hmm.
So really try to take a very like comprehensive, holistic approach. And then that's one side of my practice, and then the other side is manual therapy. So I've always just been really interested in movement, biomechanics, how our body holds itself up, our posture, how we move. And so the manual and movement therapy side of things is one of my other favorite modalities to use with clients, maybe people who are in pain or people who just want to move better and feel better in their bodies.
Yeah. Maybe like stagnant in different levels, maybe beyond just physicality, mentality, spirituality.
Hmm.
When you start talking about things like, you'll keep hearing us say TCM, traditional Chinese medicine, or just like this Eastern philosophy. The big difference there, the blinding difference, I would say, between Western allopathic medicine and this Eastern culture is they have no separation between the tangibles and the non-tangibles. It's
Yep.
completely intertwined within their really nutrition based. Their, Chinese medicine is very herbal in their histories, and, they have a lot of exotic plants. Like if we went over there to ever seek treatment, they would have these like, a dispensary, an apothecary of herbs, just like shelves of herbs of things that we would have no idea what they do, what they came from. And so I think when a lot of that came over into, started to blend into our realm of medicine, it just seemed super foreign. And,
Hmm.
fast forward hundreds of years now, everybody's heard of acupuncture. There's so much research done on acupuncture and things like that, that it's not so taboo anymore. It's just common word, common practice, but I don't know if a lot of people have really still intimately experienced it. And so,
Yeah.
that's what I again, obviously I'm a chiropractor first and foremost, but I use my role as like this doorway to other healing techniques because I think people have found a trust in me. Maybe they'll take my advice on go see an acupuncturist or something like that. So I like to be that frontline advocate for maybe some, off the beaten path type of holistic care.
Yeah.
So I mean, I definitely want to talk about like, my first like weird experiences with TCM and Meridian care, but I guess just to, give a fresh, description of what this is for people who aren't really familiar with acupuncture. Um, the Chinese medicine system, back in the day had a lot of different branches. We just talked about the supplementation, the nutrient aspect. There was actually a bone setting portion. So I feel like I'm kind of a modern bone setter. It
Oh yeah.
was super aggressive, like pulls and multiple people pulling and
Whew.
decompressing. And just, yeah, there's some really crazy videos. And then the more familiar portion, the needling portion. So the actual true acupuncture system. And so that part is when I think we say, hey, meridians in Chinese medicine, they think, oh, needles.
Yep.
Um, so Chinese medicine believes that there are these channels within our body. They're not something you can dissect. They're like these, vibrating, and I'm obviously, all this, I'm reiterating it, but, these vibrating systems of energies in our body, and they call it chi, just like yoga would call it prana. We're all trying to talk about the same thing. We just have different, depending on your culture and your belief system, there's different verbiage for it. So the acupuncture and the specific points of where they needle are to create balance between these different systems that are all supposed to coordinate and communicate and flow. And we'll get into this for sure, because this is where I think you would be great to, shine some light on the organ part of it. They really dive in to their belief system, and that certain organs represent different emotions and can, peak at certain hours of the day versus crash. And so when we see on the medicine side, when we see people with hormonal imbalances, sleep apneas, and sleep issues, I should say more so, acupuncturists really want to know the timing of these issues, the timing of a heart attack, the timing of your anxiety attack, because they believe that the organs and the chi systems are trying to speak to them.
Mhm.
So, in a nutshell,
Yeah, and you
right.
made a great point too about how a lot of times now in the Western world, it's kind of seen as something that's sort of like taboo or woo woo or like
Hmm.
weird and foreign. And the funny thing is, like, this kind of work has been around for 7,000 years, 6,000, like it's been around for
Right.
ages.
Beginning
And
of
there are
written time.
right.
Yeah.
And there are places in the world where like this is the only form of medicine. Like this is what they use to treat all things. And like you said, now like you can't really argue it because it's time tested. There's
Hmm.
also all these incredible clinical studies now that show, hey, like this does work under our rigorous like scientific testing.
Hmm.
And then there's all kinds of incredible anecdotes out there. Like ask go ask your friends. I'm sure someone has had a great experience with acupuncture. So
Hmm.
it's like it's one of these things that it's really hard to argue these days, and it
Yeah.
seems a little like out there for our Western rational brains, but
Right.
it works, and it's like an incredible cohesive system.
Yeah, I do get, that's probably like the most common question I get in a chiropractic realm of, hey, does that really work?
Mhm.
Like I'll mention something of, I go see of an acupuncturist. I'm acupuncture trained, minimally compared to, someone who went to full blown acupuncture schooling. In chiropractic, in certain states, you are allowed to practitioner, you're allowed to needle, you're allowed to get into the energy medicine portion of it. And so I was very fortunate enough to train while I was in school and then utilize acupuncture, actual needling in the system for a few years. Now back on the East Coast, I respect, the differences in our scopes. And I really do like to refer people to true acupuncturists to get that like full pizzazz. But I love the question of like, does that really work? And I have to be honest with people. If just like you would send someone or not send someone to yoga or meditation, like you have to know your personality.
Mhm.
If people are going in with, I'm expecting this to like save my life in one session, and then I'll figure out afterwards if I'm going to give it a chance.
Right.
What do you expect? What do you expect to happen if your body's going in super resistant? So I tell people that, some people are really afraid of needles. So that's a
Mhm.
huge barrier.
Yep.
These are not the type of needle that is going to cut your skin. They're so tiny. They're about the eighth the size of a syringe. And they actually are very rounded at the tip. I mean, they're so tiny, you would never see this, but it's very subtly rounded. So it separates the tissue as it's going into your skin instead of slicing through and damaging like muscles and fascia. With true needler, you really shouldn't feel it. But that is a huge barrier. And then I really just say like, hey, if you're not good at laying still for 45 minutes, you may have a hard time with acupuncture. Like it's mandatory meditation because you've got needles in you, like can't really move.
Yep.
So I say like, hey, if you're going in with like a very specific orthopedic injury and that's all you're looking to see benefit from this one session, you may not be satisfied. You may have a hard time understanding the global look of, Chinese medicine on your body.
Yep.
So, I mean, I don't know what you would say to people when they do that, like, oh, does it work? What would your answer, your
Yeah.
recommendation be?
I tend to just share. I think people resonate well with personal experience, so I tend to share my experience.
Oh, let's hear
And
it.
I have, I would say a pretty good experience with like the TCM world. But I think it also depends a lot on the sensitivity of the person too, whether
Hmm.
that's like energetic or physical. Like years ago when I first did acupuncture, I had great experiences, but I was a little more like maybe armored. Like I wasn't as in touch with like as aware of my body and like what I'm feeling
Hmm.
and like the signs and signals from my body as I am now. So now when I go into acupuncture, like, the day of and the day after and a few days following, I feel like a completely different person because I'm more like tuned to what I'm actually feeling and like little energetic shifts, whereas years
Hmm.
ago I wasn't.
The
So I
subtleties,
think
yeah.
I think that speaks to like I think regardless, it is doing something in your body. Like
Hmm.
something is happening, but you might not be as sensitive to that. So it depends on the kind of person of like who I might send towards an acupuncturist.
Hmm.
But I think it's one of those things. It's like the risk benefit. Like there's not a huge risk. Like the worst that
Right.
happens is like, oh, like maybe I didn't really feel much from that one session, and then
Hmm.
you move on. It's not like
Exactly.
a orthopedic surgery where it's like, all right, there could be some serious
This
complications.
is life altering, yeah,
Right,
hour and a half.
right,
And just like any providers, there's so much variety within their own interests. So you saying like, hey, go get acupuncture. I always like to send people to someone I've had a personal experience with because
right.
I have a couple different local people. I know their different temperaments, their different views, what they're looking for. So I
Mhm.
try to match the person to who I think they're gonna jive with.
Yep.
Um, did you seek out acupuncture? Did someone kind of like nudge you into it your first time you went?
Yeah. What happened? So I started learning about the whole world of Chinese medicine and holistic health. I don't remember exactly what year, but maybe, I don't know, 2016 or something was when I first started diving into some of this work. And I
Hmm.
started taking a few of Paul Chek's courses.
Okay.
And Paul does such a great job at kind of like pulling all the golden nuggets from all of these different areas of health, whether
I
it's
love that.
nutrition, the Ayurvedic, the chakra system,
Mhm.
Chinese medicine. Like, I don't know if you can see, but that poster right there,
I see the
it's like
blend.
combining, you see the
Yeah.
chakras, you see the physical body, you see the organs. Like he's so good at combining all those things. And so he talks a lot about Chinese medicine and the organ system and the meridian system. So that's where I first started learning about it. And I just thought it was really cool. Like I was like, wow, this is really interesting. And I read a few books that weren't by Paul, but by, acupuncturists and oriental medical doctors because I thought it was interesting. And
Hmm.
um and then I kind of just dropped it for a little while. Like I tried getting some acupuncture. I had a great experience, but I wasn't like, oh my gosh, like this is it. Like
Right.
I've got to go learn this. And then as I got further on my health journey and I started working with clients of my own, I started to like kind of see certain things that I couldn't really explain, whether that was
Hmm.
like emotional things or physical, like things that just didn't make sense to me. I was like, okay, like we're doing this and it's not making any change. So then you start to see these really like uncanny correlations between things like
Hmm.
physical symptoms, your organs, and all these things. If you look in the whole like comprehensive Chinese medical system, it like explains them to a T.
Right.
So like I would see these things in myself and my clients and be like, what's going on? And then I read this Chinese medicine text and I'm like, that's it right there. Like it
Right.
explains it so perfectly.
Yeah.
So
Do
when
you
you
know
start to
that is
see these,
actually how it was created?
yeah, through like the experience of the people,
So,
right?
I mean, it sounds so archaic to like say, and we're talking long time ago here, people, but I believe it was battlefield injuries.
Oh, interesting.
So, yeah, so they would just, somebody would be shot with an arrow,
Hmm.
hit in like a certain region, a certain part of the body. And
Hmm.
over the many, many thousands of years that they've had to like fine tune these exactly weird correlations, I think the example that always stuck in my mind was like an arrow in blank. got rid of someone's hay fever. And, so that's
Oh,
how these like
interesting.
wild jumps kind of came. And then,
Wow.
just, masters and mentors and fine tuning. And then I'm sure just like the intuitive aspect of it, they've been able to now, pinpoint it so closely that it is reproducible with research. So
Yeah,
quite the flip from
it's
someone getting
incredible.
stabbed and then being like, oh, hey, I can see out of this eye.
Right.
That would probably
Right.
be an ear thing.
Yep.
Um,
Yep.
yeah,
And it's the
but
complete
it's
opposite of what we do in the Western world.
right.
Whereas we research something, like a medical drug, for example, we put it through all this rigorous research and then we send it out into the world for people to use. And it's like,
Mhm.
it might get the desired effect, it might not. We don't really know what's going to happen, but let's try it and see what happens. Whereas it's like through the experience that these battlefield doctors were having over years and years and years, it's
Yeah.
like, it's just such a crazy flip flop. But
Yeah.
again, it works. Like we arrived at the
Yeah,
place we are now. So,
when I chose to, and full disclosure, when I got into my first acupuncture training, I was very stubborn. I was in that, like you called it, my guarded time of being a student. I thought
mhm,
I knew everything. I was going to be this like macho, crunch, sporty chiropractor,
yeah.
and I wanted to dry needle. So dry needling is more of a physical therapy type approach to use acupuncture needles. It looks very similar, but the system is just the surface tiny blip of the iceberg compared to what acupuncturists are looking for.
Hmm.
But when I was practicing in the Midwest, you had to be acupuncture certified to even take a dry needling course. So I
Mm.
just sat there in the corner, arms crossed, like I don't want to listen to any of these crazy, people and their energy stories. I only believe
Hmm.
in like solid research, evidence based, tangible medicine.
Yep.
That was my first time was a 100-hour class. I think it was hour 90 when I finally was like, huh.
Like,
Yeah,
okay,
something,
there's something going on here.
something's happening here. I had this little tiny, really tiny old lady teacher, just like very authentic, stereotypical looking, teacher. And I'll never forget, I think it was like I took a pack of vitamins, like a huge pack of like multivitamin, other things in there, empty stomach, super early class, and just got green, nauseous,
Mm,
just how
mm.
vitamins do.
Yep.
And I couldn't pay attention, and she kind of like caught me like struggling, and I was contemplating going home, but I had to finish my hours. And she came over and just held like two parts of my wrist, almost like where you would have one of those like nauseous bracelets on a cruise.
Yeah. Yep. Yep. Yep.
And, but with the added intention of like a human component, like I'm taking this out of you, I'm helping balance you.
Mm,
And I'm
yeah.
just sitting there like, oh, this is so awkward. Everyone's looking at me. And
She's like
it's
staring
like,
at you, like
yeah,
holding your
yeah, the whole
wrist.
thing. And I'm just like trying to play along. And then I really did just feel like this nauseous to just leave my body,
Wow.
just
Wow.
completely empty. And
This is so
like I said,
cool.
that was like
So
the
cool.
last day, the last weekend of my course. And I was like, crap. Like somehow I need to pay attention. Like I need to learn this now
Right.
because there's something deeper here that I need to know beyond, this curriculum that I'm going to learn in my school.
Yep.
So that was my first little like humbling, sit down, shut up and pay attention to your elders type moment.
Yeah. I've had a few
Um,
experiences like that, and I've had a similar experience afterwards where I'm like, wow, like this is so amazing. Maybe I should have studied acupuncture instead of manual therapy, or instead of, obviously they all fit together, but looking
right.
back, I'm like, wow, this is like such a cool comprehensive system. Like
Mhm.
it's really amazing.
And then I think when I finally said, okay, I'm going to go see an acupuncturist, I was in
Mhm.
Kansas City at the time in school, and I went to an alumni from my school and kind of wanted to like test her out. Like I filled out my health history mostly, mostly, and I
Yeah.
kept off a few things. And
Right.
I went in, I had hip surgery when I played soccer in college and wanted to have, my hip pain like worked on a little bit. So I went in with that focus. And as she's working on me, she set the needles. I was just laying there, and she also did hands-on work, which not
Oh, cool.
every acupuncturist will do.
Hmm.
And hands-on work is actually hands-off work, but almost like an intentional, like kind of scanning of your body. They believe that they can feel these lines of energy through your system, and sometimes it's like a heat, sometimes it's a conversation, like of a temperament, of a taste, of a season.
Hmm.
But as she was working around my hip, she kind of pulled off and was like, "Hey, did you have an infection from your hip surgery? I just am getting the sense to talk to you about infections, and I kind of feel like I'm seeing tubes being pulled out of your abdomen and over near your hip." And I looked down thinking she was working down near my labrum scar, and I peeked down and she was actually on my appendix scar. And
Oh,
and
yeah.
yeah, I mean, and at this point, years later, it's like a little laparoscopic thing, like it's barely noticeable. I had
Hmm.
not told her I had had an appendectomy 10 years prior. Um, and that was, an emergency surgery. Like she had picked up on this experience that was obviously still living in my body and was like in the presence of this right healer coming to the surface, like, please talk to
Right.
me, please get
Right.
at me out of here. So after those two things, I was like easily sold.
Sold. Yep.
I need to feel it on my body. I need to like it's just seeing is not believing, feeling is believing
Yep.
to a healer.
Totally.
So I don't know if you had any of those kind of like weird moments of like, okay, this is for me.
Yeah, for sure. I think one, that's so cool because I have also had my appendix removed. So
Yeah.
like I think always relate on that one. Um, but yeah, I think for me, what would be a good example? Oh, so for a while now, I've been doing some work on my liver, like some more physical work. So trying to like kick my liver into gear, help it detox, help it do what it needs.
Mhm.
And because our liver is so important, like it converts thyroid hormone, it has like 300 jobs in our body, it detoxifies our blood, does all these amazing things. And mine's been like a little sluggish, dealing with some like toxin overload stuff. And I could tell that due to some different like physical symptoms that I'd been having. And I'd been tackling it from like a purely physical standpoint. So I've been, using castor oil packs on my liver and taking bitters before I eat and like doing all these, eating liver supporting foods, doing all the things that
Mhm.
are supposed to help detox the liver, which I think are important, like tackling
Right.
it from that kind of physical sense. But I was doing that for a long time and just wasn't really helping. You know what I mean? Like I wasn't really moving the needle. No pun intended, needle, but
There you go. Yeah.
but in Chinese medicine, the liver goes with like the wood element, which
Mhm.
is like our intellect and our knowledge, our thinking, and then it goes with anger and frustration as an emotion. Like TCM is a very comprehensive system. It talks about emotions, it talks about how we relate to nature, all these amazing things. And so from that like TCM kind of perspective, I started realizing, okay, maybe it's more emotional, maybe it's more lifestyle based. And so I started shifting the way that I viewed the body and viewed how I treat things. And from that TCM perspective, like metal controls wood, and
Mhm.
metal is like our feeling, and wood, our liver, is like our thinking. So I had spent many years like loving to study everything, always spending all my time in my head, in the intellect. And it wasn't until I started leaning into doing less intellectual things and leaning more into the feeling side of things, whether that's moving my body, breath work, some other modalities of body work,
Mhm.
things started to shift a little more. And that opened the door for me to be able to work on the emotional side, getting some of that repressed, like anger, frustration, moving, they call it chi, getting the
Yeah.
chi moving through the system. And it was just so cool to see things start to shift. And that didn't mean like I immediately got better and all my symptoms immediately
Right.
went away, but it
Right.
opened the door to work on some deeper things. It peeled a layer back of the onion so that I could like address the next layer
Mhm.
and just reach a new level of health. So it was really amazing to see that in my own body. And now I use that same TCM lens when I'm working with any of my clients. Like if I have a client who's super anxious, like the spleen organ, we correlate with anxiety, and that's the earth element. So getting that person grounded, getting them in like routine, more stability, because the earth is very strong and stable and steady. It's just such a cool way to look at the body and look at treatment.
Yeah. No, that's so perfect. And this is really kind of the next like segue into this conversation is, we kind of talked about like how we found it and like what it really, what it is. But it's interesting to like hear that and, whatever, read research, but like to understand like what it could offer you, what it could shake up in your life if you do the same exercise for years, the same, oh, I'm going to not eat gluten, not eat dairy this month. And, like I tell people, we got to shake the system. We got to shock the system a little if you want to
Yep.
start seeing a break in this plateau. And the elemental component of acupuncture is, like you said, now I'm trained in acupuncture. I can't unsee this lens, right? I can't
Mhm.
not see someone's chi system, feel their system, and have a doorway to this conversation. So even though I'm not like actively needling anymore, there's so many ways to still address your temperaments, and the elemental components. So it's called the Ko cycle, KHO, if I'm pronouncing it hopefully correctly. It looks like a star. It's 5 circles, and each circle represents a couple organs. You can look it up online, and this is kind of like a quick cheat sheet chart for people when they're looking at acupuncture to see how certain organs are categorized in an element. So we've got our water, our metal, our wood, our earth, our fire. And so these elements can contribute to each other. They can combat each other, but they're supposed to be working in harmony. And just like fire, bad say to say, but just how fire burns wood and, everything like that. We're dealing with some wildfire smog here today, but all of these things are representative of human behavior, human temperaments, as well as our actual like systemic organization. So I think acupuncture for me now, when I look and view people, I can see their elements. So that's interesting. I'm different system, but in astrology, I'm a Sagittarius. I'm very fiery, very dynamic. But when someone comes in and I'm looking at them through that TCM lens, they've got very tiny wrists. They're very skinny. They're very frail. They're very, not really looking me in the eye. I would almost call them like a windy person. So an air element. So I know that I need to simmer to really connect and be where they are, as well as help complement, those other elements within their own health journey to, benefit an air element, or, to fill in the gaps and the holes. So when you're talking about those organs and the elements that they go with, the emotions that are traditionally tied to, no one really bats an eye when I say, yeah, like your liver is your home of resentment and anger and hatred. They're like, oh yeah, I get that.
Yeah.
I'm like, you know what? So it's like almost so normal now that there is so much symbolism in the body, and there is these like, energetic metaphors. And I know you do a lot of work with, well, your own personal health history, but I know you're coaching with a lot of diabetic clients.
Mhm.
How do you pull some of these, emotional conversations for things like the pancreas and things that are pretty tied to insulin?
Yeah, for sure. And I think everyone is so different. So while all of myself and like my diabetic clients do have something big in common, like
Hmm.
what we've gone through in life and where we are and our environment, like it's all so different. So it's hard to say exactly like, I give each client with diabetes this one pancreas like qigong exercise. Like I wish it were that simple, but it's always so different. But yeah, it's definitely just comes back to like the lens that I see things through, whether I'm working with a client who's on the table and we're doing like manual therapy or movement work. I do find myself like a lot of what I will prescribe or like recommend for people to go do, whether it's lifestyle or particular to movement work,
Hmm.
is through that lens. So like I mentioned with myself, I prescribed myself to do less intellectual work and to do more like playful feeling type
Hmm.
work. Like that was my recommendation to myself, and I followed that, and it shifted things.
Yeah.
There are
Almost like the
certain
opposite of what the liver can house. When the
right.
liver starts to build up in a negative way, that anger, that, bitterness from, chronic bitterness, you had to play. You had to, almost reverse and allow some other energies to like break through and kind of re-soften.
Yep.
You mentioned Qigong. For people who don't know what that is, will you tell us a little bit about Qigong?
Sure. Yeah. So I might not have like I'm not a Qigong expert. Like I might not have a perfect explanation, but it's a great, it's based in Chinese medicine. Like that's kind of where it began. I guess I'll talk about like the medical Qigong, where
Yeah.
basically it's like it's a prescriptive element for acupuncturists or Chinese medical doctors to take that Chinese medicine lens. So looking at a person's, energy system and what organs might be balanced or imbalanced. And you can prescribe certain exercises that combine breathing, body movement. Maybe you're thinking about certain colors. Like it's a very bringing you into the present kind of practice.
Mhm.
So I'm sure you've seen like people in the park standing there and like doing certain stretches or like twisting. And there are some very basic qigong movements that can just be done for like general health, like something you could equate it to like the Chinese version of yoga, which is kind of a very
Yeah.
generalized way to
Yeah.
say it. But
Organized movement that has intention for something beyond muscles and bones, you know?
exactly, exactly. And even if you were to do it just through a physical sense, like, oh, I'm going to turn on this, 20-minute morning qigong, you don't necessarily have to think about the like energetic side of things. Now, you and I know like that is a big piece of this work. Combining
Right.
breath and movement can have some like serious energetic benefits. But even if you were to just do it as your chief form of exercise, like that's great too. You're getting out, putting your feet in the grass, moving your
Yeah.
body, like wins all around.
Yeah, just, being in the being in that presence, like, you kinda get the after effect anyway, whether you know
Right.
it or not.
Right.
And I
Yep.
think a lot of actually, that kind of transfers into a lot of, like, what chiropractors are doing and things like that. So a lot of really powerful meridians, I'm gonna my baby in the background. A lot of powerful meridians that run throughout the body. Like I said, they're not super, we couldn't dissect them, we couldn't find them, they're not tangible, but because they're there, just because someone doesn't have maybe the outlook for acupuncture or this, they're not trained in acupuncture, doesn't mean that they're not affecting
Of
these
course.
meridian systems.
Yep.
Two of the most powerful meridians that actually run right along the spine down the back are, the kidney meridians, the bladder meridians. So maybe it's just, a part of the effect that chiropractors can have on people are by adjusting and changing this nervous system approach and affecting the tone there. Part of that punch and the benefit that people see could have come from we're also influencing, the meridian system.
Sure.
So you're out there. I believe Qigong has this sense of like cultivating and channeling energy with its movements too, right?
Yep. Yep. I was just gonna say that it would be
Yeah.
considered like an energy cultivation exercise because you're helping to move energy that might be stuck or like not moving in the right way and just getting it kind of circulating in your
Mhm.
system. So that's one benefit that I've definitely noticed, and a lot of other people notice who do qigong and tai chi and similar movements, where it's just like providing you a little more mental clarity, helping you sleep better, like just you might just feel more energized throughout the day.
Yeah.
Yeah, it's pretty amazing, and it's so simple, really. Just standing in the grass, moving your body, breathing, like.
Yeah, my dad is actually a practitioner too. Qigong, he loves it. So he'll
Oh,
just like
cool.
put on something in the morning, and it's his. So he is in a wheelchair or a chair,
Mhm.
but it still gives him this sense of clarity that he's doing something to improve his connection with maybe a part of his body that neurologically he is not
Mm,
communicating with. So
sure, yeah.
I love knowing that he is enjoying that, understanding that there's still something to blend in his body beyond just looking at a physical proof of is it working or not.
Right.
Um,
Totally.
and if nothing else, the acupuncture system for me has just always been a portal of deeper information.
Hmm.
So, I know you're also a massage therapist. So, when you're working with soft tissue work and manual therapy with people, it's you just like the more you work with people, the stuff comes out, right? And you see these like,
Hmm.
how is this possible? Or I only touched her shoulder. Why is she crying? Like she came in for
Right.
knee pain. So the acupuncture system took my, perspective as a clinician of chasing pain and it just like completely took the blinders off
Hmm.
and opened my eyes to how things are way more global in the body. And it's just like a simple sentence as that when people come in and they've got jaw pain and I'm playing on their opposite ankle, sometimes I'll just be like, "Oh, this is acupuncture." And they're like, "Oh, okay."
Right.
They just like with no idea what it is, but they understand this like that there is this mysticism, there's this non-tangible, something you can't really put words to, but they
Mm,
understand that because it has this ancient component, this special component, something could make sense that the distant site is being affected by, the stagnation or the old injury of, a farther region of your body. So, um,
totally.
that I really appreciate having being part of my practice. And in this chapter in this book, the title is becoming a more connected healer slash acupuncture.
Yep.
So yeah, the learning the acupuncture system, even just being exposed to it in my personal body, um, kind of turned my trajectory around where I was heading to be a clinician. It's kind of put me off a different path into I'm actually probably going to be a healer.
Hmm.
I could have been a fine, very sports chiropractor clinician, but if you have these gifts and you have an opportunity or some amazing mentors who like kind of hand you the next key. This was my becoming a connected healer chapter.
Totally. Totally.
Yeah.
Yeah. I feel like I'm on a very similar path for sure. And I appreciate having mentors like yourself and other people I've worked with in the past who have kind of pushed me in that direction. And also sometimes we just kind of fall into that because we're sort of forced to, like through some of my own health issues. Like I've been kind of forced to do some of this work. Now, really, it's a huge blessing that I've like had to go through some, very tough trials and tribulations because I've learned all this incredible stuff
Mhm.
and I'm able to pass that along to other people.
Right.
But sometimes we sort of just like stumble into it and you're like, whoa, I wasn't ready or looking for that, but it's exactly what I needed,
Mhm. Yeah. Do you still go to acupuncture anymore, or do you see somebody here and there?
I do. Yeah.
Awesome.
I just had a session two days ago now.
Oh, nice.
Yeah.
Do
Yep.
you traditionally, I mean, it's like for me, I know I leave kind of in that yoga high, like you're kind of buzzing when you leave. How fast or, do you see yourself process things after a session?
Yeah. That's a good question. It's funny because of like the level of sensitivity that my system is at now, I used to just have that sort of, you described it as yoga high, but like that very like just Zen kind of feeling.
Mhm.
I used to get that and it would last for a couple days. Now it's very clear that depending on who I'm seeing, I've seen a few, like, my functional medicine doctor, she does acupuncture. I see an acupuncturist when I'm in New Jersey. So like, I've seen a few different people. The type of acupuncture, there's a few different forms coming from different places. Like it's
Mhm.
different in Korea to Japan to China.
Right.
So the type of acupuncture, some of them kind of get my system like stirred up and really like, oh, I need to go for a walk. I need to move. I need to do
Mm.
something. Whereas other forms like really bring me down and like in a good way, very calm and like, oh, I could just take a nap right now. Like I want to
Yeah.
go watch birds or something.
Yeah. That
So
that's
it's
interesting that
interesting
you
to
mentioned that. Have you
see the
ever seen
differences.
different metals in the needles that they use? Have you noticed?
No, that's a good question.
Okay.
So what I have noticed is one of my practitioners uses much thicker needles, and
Mm.
he's described it to me as he's working to stir up energy in the body. So he doesn't use like the little guide tubes to like calmly put them in. He
Yeah, yeah.
purposefully like gets them in there to
Go
like
for it.
stir things up and get things moving. So it's a little uncomfortable from the start, and
Right.
it takes a second for my system to kind of like calm
Accept
down
it.
after it and accept it. But
Yeah.
once it does, like it clearly works like energetically, like it gets things stirred up and get things moving.
Right. And
So
they recognize, as they're really experienced, they recognize the certain meridians, the parts of your organ systems that need to be,
mhm,
ignited
stirred up.
versus, the other ones that are probably working too high and are overpowering those other sleeping systems.
Right.
I asked because not so much anymore. People really just all use stainless steel, but certain metals have different components in their system. Concerning like a gold has like a sedative, I believe, versus other
Oh,
metals can hype up meridians,
interesting.
certain kind of sedate them. They believe stainless steel is kind of in the center. It's like this
Okay.
intuitive, almost like an adaptogenic herb, right?
Right.
Like,
Right.
if you put this stainless steel into the system and your body knows what to do with it, it needs to,
Gotcha.
it can kind of take more or it can ignore if it already has enough.
Yeah,
Um,
that makes
I
sense.
haven't had that like, stimulant, irritant type of acupuncture. So I'm not sure if I want it, but I've always had more of like you said, like the gentle tube insert. And that's how I was trained to practice as well.
Gotcha.
Probably because I'm a chiropractor, our goal is to bring the nervous system back to an ecosystem of natural tone.
Hmm.
We try not to instigate if we don't have to.
Of course. Yeah.
Um,
I'm
yeah,
sure it
so
takes a lot of time and training and experience to be able to understand that more like stimulatory side of acupuncture.
for sure.
Like being an acupuncturist or a Chinese medicine doctor feels like it's probably a prerequisite for
Mhm.
diving in that deep.
Yeah, they have so many different diagnostic tools, and the word diagnosis is not, it's not something that, like you said in the beginning, our Western, mindset, this logical mindset, there's not a tool that reads this is low, this is high. You know, their
Right.
diagnostic tools are very, very intuitive, very ancient, like looking at your tongue, monitoring any differences of your ear structure,
Hmm.
feeling a pulse difference between your wrists. They feel like they can tell the different organs are, you know, struggling versus exhausted, maybe just by feeling like a difference in your pulse. So that's some serious training for,
Hmm.
you know, understanding those differences. Earlier we were just talking about how like certain things come to the surface, and as a massage therapist, as I'm doing muscle work as well, soft tissue work, um we I feel like you can only release stories that are on the surface with
Mm.
those type of tactile practices.
Sure.
Acupuncture has always been, you know, the needle is like this portal. It can
Mm.
go deeper. It can get to some of these deeper layers of fascia and, you know, bypass maybe some of our instinctive barriers on the surface, not even
Yeah.
just like actual skin. I mean, like, you know, our temperaments and our resiliences. So needles have always been a way to just highlight things that people have forgotten about.
Yeah.
You know, stories of like, wow, yeah, you know, actually I did fall. I really hit my head, you know, 2 years ago at this time, only because I put needles in them, when a second ago I'd asked any other relevant information in this area, and they're like, "No."
Hmm.
So the portals of information that come through these needles, I mean, we are just this huge electric system, right? So why wouldn't a metal, almost like this conductor in us, you know, fine tune our electric circuit, like kind of reboot us? So when
Yeah.
I try to speak to somebody who doesn't understand the woo-woo stuff, I keep it to electricity. You know, I
Yeah.
talk about like the electric component.
Yep. Yep. And I think you made a good point about the idea of like getting to the surface of something versus the body work side of things, which tends to like help you move through things that are on the surface. That's why I
Mhm.
think doing comprehensive work, like combining body work or movement like qigong with something like acupuncture, there's so much value in that because you're kind of getting both. Like the
Right.
traditional healing model is like you're peeling back layers of the onion until you're getting to like deeper, more root cause issues that you might be dealing with. And to be able to combine the body movement side of things, the like touch therapy side of things, with those like accessing those deeper portals of information is so,
Right.
there's so much value in that.
Oh, absolutely. And you had mentioned that you had a mentor who kind of took his favorite from like a bunch of different systems to
Hmm.
to build, you know, his practice or his outlook. And that's what this is. This is one chapter in a book. And that's like such a gentle introduction compared to someone's like schooling. But that's one tool on the tool belt, you know,
Yep.
seeing functional medicine, seeing your actual, you know, primary care physician, seeing a chiropractor, a physical therapist, a Pilates instructor, yoga teacher,
Hmm.
you know, the acupuncturist. This is just like, I build this like round table, you know, of providers. And I think that's part of our healing enlightenment process, is to know when the next step is who, you know, which practice.
Yep.
Like, you know, I've really been hanging out with my chiropractor a lot recently. I think I've gotten to this level of balance. What's my acupuncturist up to? You know, like maybe my next
Right.
visit is I'm going to save some money and, you know, head towards acupuncture for a few months, that kind of thing. So, uh,
Yeah.
I never taken personally if I hear that from a patient that says, "Hey, I think I'm gonna spend some time with acupuncture." I'm like, I am so happy that, one, you feel comfortable enough to say that to me, but then also that I've like created this environment for you to recognize your own next step.
Hmm.
So
Yep.
yeah,
It's
that's really
powerful.
awesome. I'm trying to think if there's anything else that I really wanted to touch base with you on, but I mean, I love I love the things that we hit. If
Hmm.
you don't mind, actually, I just want to read this list of Dr. Richard Yenny was the just the complete visionary acupuncture teacher in the Midwest. Didn't get to learn from him personally. I had just passed, but I studied in his program through chiropractic school.
Hmm.
And part of our teaching was his list of how to become a more evolved healer.
Oh, cool.
This was in like page one of this notebook, and I found this years later. I wasn't even ready to read this list or to like recognize the importance of it at that time.
Yeah.
But number one is connectedness, which is impossible to be, you know, to not be connected when you're touching somebody.
Hmm.
Two, a transformation process, you know, assessing the body, wanting to not just like quick fix, get it to somewhere else, but like help it transform to permanence through it. Removing blockages to healing, just like chiropractic. Like, I'm not trying to fix you. I am trying to remove these barriers that help your body naturally do its thing towards
Yep.
healing.
Yep.
Contend with detachment. I think that's for us. I think that's for the healer. Like, you just don't always get to know why in acupuncture.
Hmm.
There's
Yep.
not a why. There's no,
Yep.
there's not always like a straight protocol or if this, then this. It's to be an acupuncturist to have this TCM mindset, you really need to like lose the ego and detach.
Totally.
Number 5 is future vision. So maybe like, some things like you said of just like this being part of your healing journey and being part of like shaking up the taking off that, layer of the next onion. What is next? And number 6 is just gratitude and surrender. So I thought about that when you said getting outside with Qigong of just, being very grateful for your environment, surrendering to we are a super tiny piece of this like gigantic
Hmm.
working system.
Yep.
So that list always really speaks to me.
Yeah,
I'm
love
sure
it.
it applies to everybody's interest, your specific techniques and things like that. But I had to include it in this chapter because it really was. It's like the door. I've called acupuncture my gateway drug before. It was like the doorway from normal medicine into weird stuff, and then I just kept
Yeah.
but it
Yep.
was
Yep. Totally.
yeah,
Totally.
so thank you so much for chatting about this today, Nick.
Of
You're kind of
course.
I'm re-falling in love with this practice and this mindset, and I feel like I'm due for an acupuncture session. I haven't been since probably I was like 8 months pregnant.
Oh, wow. You're definitely
I
due
had
up for another
I
one
had
then.
her on I had her on call in case I didn't start to go into labor on time. I was gonna go try to get induced acupuncture style,
There
but
we go. Yep.
yeah, my body did its thing. Um, but yeah, I hope that this has triggered, a little interest for whoever listens to this and, maybe find somebody, hopefully it's a good guidance or mentor of how maybe acupuncture could be part of your next step in healing. As always, please feel free to reach out with any questions. And Nick, what's something that's I'm going to tag you in like our social medias, but what's your platform that people can follow you?
Yeah. So I am primarily on Instagram. My name is Nick Kundrat, Kundrat. So you can follow me there. Like she said, she'll tag it in there. But I like to try to combine like humor with health, with education. So I try to put out some fun content every once in a while. So feel free to follow me there and reach out, send me a message. I'm happy to chat anytime.
Okay. It was great to see you, and I will
Yes.
talk to you soon.
All right. Sounds good.
All right. Have a great day.
Cheers.